Hello, my name is Dr. Sujay Chandran, and I'm a consultant interventional cardiologist practicing at Kingston and St Thomas's Hospital's NHS Foundation Trust. I'm here today to talk to you about the risk of heart disease in South Asians. So this topic is quite important to me, one as a South Asian, but two, because I have a strong family history of heart disease on my father's side. And I've always tried to understand why it is that, for example, this happened to my dad, but why is it that it's also happening to lots of members of my family, but South Asians generally, why are they at higher risk? So when I use the term South Asians, that usually refers to people from the subcontinent, so countries such as India, Pakistan, Bangladesh, Sri Lanka, and we know that South Asians have up to 40 to 50% increased risk of having a heart attack when compared with the general population, even when you control for the modifiable risk factors. So the common risk factors for having heart disease include diabetes, high cholesterol, high blood pressure, family history. There are people in other communities who have these risk factors, but even when controlling for these, South Asians tend to still have a higher risk of having heart attacks. Why is this? Well, there is data to suggest that South Asians tend to deposit fat around their organs more than compared to other populations, and they have an increased risk of having diabetes, high cholesterol, and high blood pressure, even when their weight is within normal limits. So, how can you prevent heart disease if you're a South Asian? So, it's important to be aware of the fact that South Asians have a higher risk, but that should mean that you go and get yourself checked out, perhaps younger than you would compared to another population. So, for example, a young South Asian gentleman, I would probably get a checkup at the age of even as low as 30, just to check that I'm not diabetic, I don't have high cholesterol, don't have high blood pressure, because these are the things that we can modify and control from an early age, which reduces your risk going forward. And at least if we do that, then the chances of a young South Asian gentleman, for example, having a heart attack later will be reduced. So I think in summary, as a South Asian, our risk of having heart problems later on in life are higher, but that should mean that we try and do something about it from an early stage, and look to ensure that we haven't got some of these risk factors which can suddenly then creep up later on and then lead to a devastating consequence, which can have bigger implications.